Hello, I'm Dr. Miguel Cruz, and today we are going to talk about something that I see quite often in my office, and that is people complaining with hip pain. So before we get into that, I want to define what are we even discussing here, because folks will come into me with hip pain. My first question to them is, where exactly is this pain? And they might describe anywhere from pain in the back to pain into the buttocks, or pain into what I actually would call the hip area. So just to let you know the differences between these, I'm going to use this model of a pelvis right here. So pain that's coming more from the back here generally is going to be coming from what we call the sacroiliac joint, which is the largest single joint in the whole body. And it's a very complex one, easy to aggravate it, but fortunately it's a joint where pain there responds relatively easily as well, especially with chiropractic care and especially if you include laser with that. Now when the pain starts getting more outward in this area, this is what I would call truly a hip pain. This joint here is called the acetabular joint. This is where the leg comes in and attaches to the pelvis. Often people will go to their medical physician and they'll get a shot of cortisone in there. The doctor will usually tell them in the early stages, well, you've got bursitis, and the cortisone quite often actually relieves some of that pain. Unfortunately, it doesn't necessarily fix what's causing that pain. So what we have to ask ourselves is, what is causing the problem? What we see, typical onset, typical story that people tell me is that they've had pain for quite a long time. It started off as just an occasional, where'd that come from? And it went away after a little while. But then over time, it's coming on more and more often and going away less and less often. Usually when they get to my office, it's because the pain has been there for a while and this time it is no longer going away. So with a proper examination, possibly some x-rays, we can determine where exactly the problem's coming from. Is it coming from the sacroiliac joint? Is it coming from the pelvis? You can tell by looking at the alignment of the joints from an x-ray or from a proper examination. What happens often is people will go again to their medical physician. They've gotten a few shots of cortisone over the years, and finally it gets to where the cortisone doesn't work anymore. And then the doctor just tells them, well, you've got arthritis in your hip, it's old age, eventually we're going to have to do surgery and give you a hip replacement for that. So what I encourage you to do, if this sounds like you need to have this checked before you get to that point. Because when somebody comes to me in the early stages, or maybe they've been told, well, you're getting arthritis in your hip, we'll give you these shots, it'll tide you over until you're ready to have surgery. My question is, well, did the doctor tell you why that hip was getting arthritis? Why was it wearing out? Because in most cases, one side will be giving the patient problems, but not the other side. And people are often being told, well, you're just getting arthritis in your hip, it's part of old age. My question to you is, well, gee whiz, is this good hip younger than the old hip? Well, of course the answer is no. They've both been there the same amount of time. So we have to ask ourselves, why is one hip wearing out faster than the other hip? And the answer for that is, it boils down to the mechanics of how the joint is working. Often these things started from an injury, a fall, some sort of stress in your life. Could have been years and years ago, maybe even when you were a child. To give you some examples, I'm going to exaggerate a little bit because we're really talking in millimeters here. If my pelvis is twisted, what's going to happen, rather than me walking around, my legs are going to follow suit, me walking around sideways like this, the body compensates. So it's going to straighten out my legs even though my pelvis may be twisted. What's that doing is causing a constant torquing in the joints in the hip socket, in the sacroiliac, even down into the knees, and even the feet for that matter. They all work together. So if that goes on for years and years and years, consider the front end of your car being out of alignment. What does it do to your tires? It's going to wear them down prematurely and unevenly. What do we have here in the hip joints? We might have one wearing down faster than the other, wearing down prematurely and unevenly as a result of this process going on and on and on for many years. So if this sounds like you, I'm going to encourage you to get a proper examination, see a doctor of chiropractic. They can determine the alignment. They can determine if the mechanics in your pelvis is working properly. Just taking drugs constantly is not going to fix the problem. If nothing else, it's just going to mask it, and the problem gets worse and worse and worse until you are ready to get a hip replacement surgery. Sometimes people wait too long, and that is their only option, but we have found excellent results by getting that hip, the mechanics working right, using low-level laser therapy. The laser actually pulls out any inflammation. Most of the pain comes as a result of that inflammation. If you see I've been talking about you today, I'm going to encourage you to see a doctor of chiropractic as soon as possible. The sooner the better. Don't keep waiting, and perhaps you can get the help that you need. Thank you. Have a blessed day.